How could a clinician utilise the research that you're doing in their practice?
The research that I'm doing and that I'm doing with other people as well is really about coming up with strategies that clinicians can use in their treatment. So I'm doing work on memory, prospective memory, so giving people strategies that they can use in everyday life so that they don't forget things that they have to do. So all of that's really directly translatable into clinical practice.
Yeah. So can you give me an example of what kind of strategy you'd be giving someone for prospective memory?
Yeah, well, the main one that we use is teaching people to use things like the calendar function on their mobile phone.
Yeah.
And although that sounds like an obvious and an easy thing to do, even people who haven't got a brain injury sometimes find it hard to work out how to program that and then how to incorporate that in everyday life. So we're doing research to try and work out what are the best way to train people in using those kind of strategies, and really how to best get them to use it in everyday life.
Okay, great. So what advice would you give clinicians in terms of some of these strategies?
I think probably the most important thing for clinicians to keep in mind is that if something's meaningful to the person, it's going to work well in everyday life for them. So really looking at patients as individuals, working out what their goals are, being really client-centred, trying to get to the goal or the activity that is going to be really important for that person, and then they'll be more motivated to work towards getting better at that.
Right, yeah.